President.
Senator from Louisiana.
Thank you, Mr. President. I'm a physician, a doctor. For the last 25 years, I've worked in hospitals for the uninsured. And so my friend from California mentions the need to ensure access to those who might not otherwise afford. That is what I've been attempting to do in my medical practice for the last 25 years. And as a practicing physician, one of the first things you're taught in medical school is first do no harm. Tragically, these videos demonstrate that some do not share that perspective. Now, when patients see their doctor, they want an honest, objective opinion. But what the videos suggest is that Planned Parenthood puts profit and special interest before the women who call on them for their advice.
The senator should be advised that the time for the vote scheduled at 5:30 has arrived. He could ask unanimous consent for additional time if he so wishes.
Oh, is it 5:30 now? I'm sorry. If I have unanimous consent for another 2 minutes?
Is there objection?
Thank you.
Without objection.
Now, again, for 30 years I've been working to get health care for folks, and so I think it is important that we ensure access to women to health care. Currently, Planned Parenthood gets $500 million in federal funding per year. If we redirect this funding to the community health centers, which I have worked with for 30 years, the health can be better served. There are 2 Planned Parenthoods in Louisiana, and there's 160 community health centers. The 2 Planned Parenthood, one in New Orleans, one in Baton Rouge, the southeastern portion of the state. The community health centers are scattered all over the state. Again, there's 160. So for every American who is troubled by these videos, we should be equally troubled by the fact that the Planned Parenthood provision of health care is geographically centered in some areas, but not as broadly as the community health centers. I'll also point out as a physician that the Planned Parenthood model of care is outdated. We now talk about clinics which are medical homes, not which are siloed into only the provision of birth control pills and, in the case of Planned Parenthood, abortion. The community health centers can provide the whole range of services, including that for diabetes, hypertension, et cetera. It is time for Congress to act. I ask my colleagues to support this redistribution of money to closer to where those patients live, to better ensure a woman's access to health care, and to address the troubling issues raised by these videos. I yield back.
Mr. President.